Okay, so I wanted to share um, um, a similar theme that Dr. Bijlani discussed, that yoga can work miracles, but their conditions apply. And I fully endorse everything that Dr. Bijlani said, and I agree with him wholeheartedly. And I would approach something similar through the work that I did with Dr. Dean Ornish over 30 years of knowing him in a 10-year period, who was the first person in the world to prove that heart disease, the number one killer in the world, with 18 million deaths globally each year, um, can be reversed without drugs or surgery. And of course, he had to challenge the skeptical scientific minds of the National Institutes of Health in the United States, who refused to fund his research because they said that at that time, this was in the early 1970s, that everybody knows that heart disease is a genetic disorder and it cannot be reversed. Even if you become a marathon runner, vegetarian, meditator, maybe you could add 1 year of life to your life, but you would eventually die of heart disease. And so nothing could be done. And of course, Dr. Ornish argued differently because he had a teacher named Swami Satchidananda who showed him when he was 19 years old the path to yoga, and it helped cure him of a very bad depression. And they discussed introducing yoga in a scientific way through research. And Dr. Ornish chose heart disease, and he was working with a man named Michael DeBakey, who was the first person to invent the coronary artery bypass operation, which was a very big hit at the time. And he would take veins from people's legs and stitch it into the heart around their clogged arteries, and it would save their lives. But after some time, Dr. Ornish noticed that the bypass surgery was bypassing the problem, and that these people would end up with clogged arteries again after 4 to 6 years. So Dr. Ornish felt that no, the surgery was just a quick fix, which of course Western medicine is very adept at, and very good at emergencies and quick fixes, but not very good at prevention and taking care of chronic problems, because it fails to address the deeper issues that Dr. Bijlani was discussing. So Dr. Ornish argued with the National Institute of Health director for funding that no, heart disease is not genetic, it's a lifestyle disease. It's due to stress and diet. And if you looked at the death certificates of the people who died at the turn of the 1900s in the United States, nobody died of heart disease. It's a relatively newer disease. And what Albert Schweitzer, who won the Nobel Prize for Peace in 1953, called these diseases in Western civilization, he called them diseases of modern civilization, including heart disease, high blood pressure, diabetes, and cancer. And so, but it hadn't been proven, and Dr. Ornish was swimming against, swimming upstream against the mighty Ganga of the reigning medical thought of its day, and which was represented by the National Institutes of Health. And they said, well, even if the director told Dr. Ornish personally, he said, even if somebody could reverse heart disease, nobody would use the draconian methods that you are suggesting, such as giving up all their meats, which the Western cultures, particularly America, are known for, and doing yoga and meditating. That just is not going to fly. That's very draconian, very radical. Why don't you do something more conservative, like ileocecal bypass surgery? So in the director of the National Institute of Health's mind, this radical, very risky surgery that carried a high mortality rate was the more conservative in terms of scientific. It had been proven to work, but in terms of the patient, that was not very conservative. It carried a high mortality rate. So Dr. Ornish fundraised on his own, raised the money, and was able to prove that following a yogic approach, it wasn't a quick fix. It took a year. So his study went on for a year, and 82% of the people were able to increase the blood flow within their arteries, and which resulted in a logarithmic improvement of blood flow to their overall heart muscle. And so I was fortunate to work with Dr. Ornish over a 10-year period. My wife, Newton, is a yoga teacher, also trained at Kevaladam in Mumbai by Dr. Sri Krishna, who's a medical doctor and has a PhD in pranayam, and who is the medical director of the Bombay branch of Kevaladam for 25 years. So I brought her from India, and she was one of Dr. Ornish's yoga teachers, and we flew from Hawaii to San Francisco 4 times a year over a 10-year period, and we worked with about 4,000 heart patients during that time. And these were people who had been through 2 and 3 bypass surgeries and multiple angioplasty procedures. They were on 20 different medicines, and many of them were on the heart transplant waiting list because they had gone as far as they could go with Western medicine, and Western medicine had nothing more to offer them. So they came to Dr. Ornish out of desperation, and I was able to see these people's lives transformed, and not just physically, but and many of these people were very, very well-to-do, wealthy entrepreneurs who had very successful careers as CEOs of corporations, but they had horrible personal pain and relationship problems because their hearts were just closed. So one of the things that I really loved about Dr. Ornish, although he was this incredible scientist, which he still is, he always said that the physical heart is a metaphor for the spiritual heart, that all these blockages in people's arteries in their hearts represent blockages of the flow of love to their hearts. And that that was really the main mission of his treatment plan and his program, is to bring these people that were very much in the realm of the ego, as Dr. Bijlani pointed out, which is very heady, it's very intellectual, it tries to figure out things, it's very fearful, it feels separated. And of course, when you feel separated from your divine source, from the creator of the universe and all of life, you're going to be frightened and fearful, and that's going to create the fight or flight response, and that's going to put undue strain on your heart and ultimately result in heart attacks and high blood pressure and strokes and cardiovascular disease, which is in huge epidemic proportions in the modern world. Dr. Ornish was able to do these incredible transformations and gain people's hearts health back, and improve blood flow, and prove it to the American Heart Association. But there's still significant resistance. However, he ended up being the doctor for President Clinton and President Obama, and President Clinton helped get Medicare funding, so that now Medicare, which is the government in the United States healthcare system program for senior citizens, in which many of the political of the Democratic Party are trying to lobby to make Medicare available for everyone, not just the older people, and because America has kind of a dysfunctional healthcare system that only the wealthy can afford insurance, or when you become a senior citizen, you become a Medicare patient. But Medicare finally in 2013, so when Dr. Ornish presented his findings to the American Heart Association in 1988, it took from that time till 2013. So about 18 years before Medicare agreed to pay for it. And now all the insurance companies are paying for it. And the insurance companies are paying for the Ornish program, not because they're humanitarians and they want people to become more spiritual and have healthier hearts, but they're saving a lot of money. They're not paying heart for coronary artery bypass operations, which are about $100,000 per surgery, and all the imaging studies and cardiac care that goes along with that. But finally, things are shifting. And so if the number one killer in the Western world can be reversed through yoga therapy and a yogic approach, which is the core basis of Dr. Ornish's program, then what does that say for all of the other illnesses? And in agreement with Dr. Bijlani, so much of people tend to, and the doctors feed into this. Andrew Weil calls it medical hexing. It's like the voodoo curse, or the curse of the witch doctor. And people believe in their illnesses and believe in Dr. Bernie Siegel's work as a cancer surgeon from Yale, that people would, the doctors would say, well, you have 6 months to live, and they would die exactly to the day of 6 months because they believe so strongly in the doctor's words. So there's so much of the mind involved and the fear. And when you're in your heart and when you are not feeling separated from your source and you've turned your life over to a higher calling, a higher purpose, and having a faith in the divine, which is sometimes it gets rocked and sometimes it's easy when you experience hard times to lose your faith. But overall, to learn that life is so much more than just our small little confined selves, and that, as Dr. Bijlani says, it's the power of love is the greatest medicine in the world, and that comes straight from God, straight from the source. And in that energy, we're all connected. And the problem with science is that science is a wonderful tool, but there's the art in applying it, and art is in the realm of the heart. It has to do with emotions and feelings based on love. And Einstein was generally considered the supreme scientist in the modern world, and even he had this beautiful saying that, with Western science and medicine now, everything has to be evidence-based and randomized, double-blind controlled studies and meta-analysis, and if it doesn't conform to those standards, well, it doesn't exist. We don't want to acknowledge it. And the ancient science of yoga has been handed down for so many thousands of years, and there's so many thousands of years of life experiences where people have experienced beneficial outcomes without these really tight scientifically controlled studies. But Swami Kuvalinanda, I just want to mention, he had the insight 100 years ago to research and put the science of yoga and the art of yoga in Western terms. He conducted physiological studies to try to understand how certain practices worked on the physical level individually, but also, more importantly, at least from my perspective as a doctor, as a clinician who's very patient-oriented, clinical studies which look at clinical outcomes. So we don't know how everything in the human body works. In fact, there was a very famous Dr. Sir William Osler, was the founding dean of Johns Hopkins Medical School, and he talked about polypharmacy, how many drugs, even in the late 1800s, doctors were pouring pills into people's bodies. And he said, we put substances in our bodies, pharmacological agents, that we really don't know the exact mode of action or the mechanism of action, how they work. and we put them into bodies that we know even less about. He said, how scientific is that? Not really. But still, there's this, in yoga, at least in the West, the studies are now coming, and and slowly it's winning over the mainstream populace. But Einstein had a beautiful saying when it came to scientific studies and examining things from that very narrow, egotistical perspective that does not consider the magnificent miracles that happen when you are aligned with the divine consciousness and things that science can't always explain. So Einstein had this beautiful saying, which Dr. Ornish quotes a lot. Einstein says, not everything that can be counted counts, and not everything that counts can be counted. So I've seen people overcome odds. I have a cancer patient that was told by his doctors 5 years ago that he'd be dead in 3 months, and he's still going strong, and he has that will to live, and he's harnessed forces beyond what Western medicine understands. But I'm very grateful to the organizers of this symposium, to Dr. Bijlani, who I have great respect for, and Swami Kuvalinanda and Sri O.P. Tiwari and Subodhji for keeping the spirit of yoga and in an effort to reach out to the medical communities and to the people are hungry and they want to believe in something that has evidence. And as far as the work that I've done with Dr. Ornish, it has given me so much confidence as a doctor. I don't like to spread false hope, and there are certain people that don't want to hear a message of hope. They're tired and they're depressed, and they are ready to trade in their body for a new model, as Dr. Bijlani says. But I feel that whatever people's journey is, it's my job to leave people with some type of inspiration. And since the number one killer in the Western world can be reversed with yoga, then what does that say for all the other illnesses? So people that come to me and say, well, my doctor said I have arthritis and there's nothing that can be done. And I said, well, who said there's nothing that can be done? It doesn't mean that just because they haven't found the cure yet doesn't mean there isn't a cure. There's a lot that you can do for yourself. And as Bernie Siegel said, he said, there's no such thing as incurable diseases, only incurable people.
Thank you, Dr. Brownstein, for sharing such wonderful instances of your patients. That clearly again brings us to the topic of why we talk about miracles, the conditions apply, which is miracles. The drugs, the yoga therapy, any application that we apply in our life obviously depends on the miracle, and that miracle is the divine source, the omnipresence. I want to really thank you, both of you, from the bottom of my heart today for taking us through this last bit of topic which talks about miracle. So thank you so much for joining us today, and I'm going to say thank you to Dr. Ramesh Bijlani and thank you to Dr. Athos Brownstein for taking this time off. I'm going to take a few more minutes because we do have a very interesting question which I'm going to ask to both of you. If you can take quickly a few moments and answer this. It's a very interesting question from one of our audiences. He says, how to deal with doubts and become more perceptive to grace. So I'm going to ask Dr. Ramesh Bijlani to answer that question first. Bijlani, did you hear the question? Shall I repeat it for you?
No, thank you. Just unmuting myself. Well, doubt, you see, is essentially a product of the intellect. And when we are dealing with deeper existence, there is no way that you can remove those doubts. Because the doubts, it is the job of the intellect to raise questions and never reach a final answer. That is what creates doubts. And when it comes to the deeper truths of existence, The intellect is unable to deal with it. They cannot be understood at the level of the intellect. And therefore, there's no shortcut to surrendering the intellect or suspending it and trying to rise to a higher level of perception. Until that becomes possible and satisfies us, at least maintain faith. So faith is in the absence of knowledge. And when the knowledge comes, then it is no longer faith, it is knowledge. But that is knowledge of a higher kind, knowledge which came from a source higher than the mind.
Thank you so much for that answer. And I'm going to now ask Dr. Arthur Brownstein to answer that question for us, please.
As an express intellect, and people get stuck in their heads trying to figure things out. There was a very famous book by a French author named Antoine Saint-Exupéry called The Little Prince. And in that book, there's a famous saying. He said, "It is only with the heart that one can see rightly what is essential to life is invisible to the eye." So the intellect, and I have a longer answer to that question too, for the really doubting Thomases or the people that are skeptical, because the mind is an inadequate instrument to understand even the basis of the physical reality for which we are here on this planet. And I was in a planetarium in Mumbai many years ago, and the curator gave me some data that really shattered my intellect to help me understand that we are on this earth, which is spinning at 1,000 miles an hour on its axis, and it's orbiting the sun at 17,000 miles an hour. And if you were to take a rocket ship from one end of the Milky Way galaxy, which is the galaxy, the universe, that our particular solar system exists in, where our Earth is, and you were to travel at the speed of light, which is 186,000 miles per second, to go from one end to the other end of the Milky Way galaxy, traveling at the speed of light would take you 100,000 years. So the diameter of the Milky Way galaxy is 100,000 light years, and the Milky Way galaxy is only one of billions and billions of galaxies, which the Hubble telescope is discovered. So the physical reality that we exist in is totally incomprehensible to our human minds. And so the mind is an inadequate tool to really understand all of life, even just the physical basis, let alone the deeper emotional, spiritual basis. But the heart has wisdom. That's the heart knows, and the heart is really how we feel the love that's inside of us and how we access the divine. And but if you get stuck in the intellect and try to figure things out, you get stuck in the mud, and you need a water buffalo to pull you out.
So clearly, I'm sure our audience who asked this question got the answer. So clearly, as much as mind and intellect, which is absolutely needed, can also be an obstacle in understanding the grace. So I'm going to, with this, thank you to both those speakers, Dr. Ramesh Bijlani and Dr. Arthur's team, and I'm going to say bye to both our speakers. Wonderful, wonderful session. So thank you, speakers, for joining us tonight.
Thank you so much.